Hi, welcome to BariNation, where we support the bariatric community with humor, humility, and honesty.
You've just tuned into a podcast that welcomes you into a community, a resource center, and a safe place that powers your journey towards personal wellness.
Our goal is you leave us today feeling hopeful, inspired, and ready to live your best bariatric life.
Hey, BariNation, it's April. Welcome to part 2 of our amazing conversation with Dr. Sarah Hayek, a bariatric surgeon at the Kentucky Bariatric Institute. Today's episode is going to pick up where we left off 2 weeks ago. We'll start the conversation revisiting that perfectionism mindset and how it can get in our own way. Dr. Hayek then does an amazing job of explaining the differences between laparoscopic and robotic bariatric surgery. And then she shares her bold predictions for obesity treatment in 2025. This episode will continue to talk about how we can lean into curiosity as a tool along our bariatric journey. But you are going to leave watching or listening today with new insights on where the treatment of obesity medicine is headed. All right, my friends, let's dive in.
Let's be honest, I don't make perfect decisions every single day.
Yeah, no, but perfection is a mirage. It will absolutely drive you crazy because you are never going to attain it. Perfection is something that you can look back and go, oh yeah, wow, I really did that the best that I possibly could have done. Awesome. But if that's what you're looking for out in the future, it is a freaking mirage. And if you think that you are going to do everything perfectly and everything is going to work out exactly how you envisioned, no, not the case.
Right. So let's not worry about that in the future. Let's worry about today, because we spend so much time thinking about what happened yesterday. What do I want to happen tomorrow? Mm-hmm. Well, you know what? Today is about to be yesterday. So let's focus on what we can do right now. Mm-hmm. And tomorrow will be easier if we make the decisions today. So really, yesterday and tomorrow are both driven by today. So let's just focus on today. Mm-hmm. How can we win today? How can we make the right decisions today? How can I right now in this moment, even if I messed up in the morning, how can I right now make a good choice? Mm-hmm. Live a little bit more in the moment. Enjoy it. Don't constantly be looking behind you or in front of you. This is the moment. Enjoy this moment.
It so perfectly encapsulates what our year is going to be all about. Right? It's that curiosity. Let's lean into curiosity. Let's wonder what would happen if you booked a consultation with a bariatric surgeon and just went in and talked to them. Exactly. Let's wonder what would happen if you are 3 months post-op and you are rocking and rolling and you're worried that that other shoe is going to drop. What would happen if you took a different mindset approach? What would happen if you just asked yourself, What if I just trust the process for a little bit? What if I just keep doing exactly what I'm doing? What would happen then? Right? Yeah. Like if you're listening to this podcast and you are feeling stuck, you are feeling isolated, you are feeling alone. What would happen if you leaned into that curiosity a little bit and said, well, what if I did connect with community? What if I did try this one thing a little bit differently? Right? What if I shifted my mindset? What if I just that phrase alone opens up an entire world of possibility that was not open to you before. That curiosity and being open to doing something differently is what creates change in our life. Change is an action, and it happens when we make the decision. It happens when we start leaning into curiosity, when we start acknowledging, I got to do something differently. Something's not working. Something is not working.
And so much of it is, I think, our perception of barriers. So I do this a lot when I work also to help Intuitive and to help other robotic surgeons start their robotic journey or adapt new robotic processes, those sorts of things. And so we adapt and implement robotic surgery into other hospitals and other systems that may not have that robotics right now. And one of the things we often talk about is the perceived barrier that this big jump in technology is. So usually people are kind of afraid and nervous about implementing robotic surgery into a hospital that's never had it before, because they think somehow this is going to be super complex and super difficult, and it's just going to be hard. And so there's a lot of resistance. And so I always give this example. I say I can take my phone, my iPhone, and I can give it to a 4-year-old child, and I can give it to my 84-year-old grandmother. One person will be working that phone. And it's not my grandmother. It's gonna be the kid.
Mm-hmm.
And it is clearly not because of their capability. My grandmother is an amazing woman who has done fantastic things, raised children, worked, achieved amazing things in her life. She's a very smart, very capable woman. But she can't work phone because she has this perception that it is too difficult, that it is confusing, that it's a barrier for her. A 4-year-old kid has zero perception that that is a barrier. And so, boom, they're playing Candy Crush, right?
Mm-hmm.
It is not about your capability, your skill set at that moment. It is about how you perceive that barrier. And if you see it as something to be enjoyable and to be fun, and this is cool, and I am going to just figure it out until it works, then guess what? You're probably going to rock it. If you look at it and go, this is scary, I can't do it, it's too much, then you can't do it and it's too much because you've set that. You've determined that. It doesn't need to be.
No, and that word perseverance continues to pop up in our discussions in BariNation and really for this whole year, because curiosity and perseverance can live in the most amazing marriage of things.
Yes.
Right? People conflate perseverance and consistency, but they're not the same. Consistency speaks about doing something over and over and over and over again. Persistence is about not giving up and about getting curious and looking for ways to move through and around and over and under. Perseverance is knowing I'm going to get there. I'm going to do whatever I need to do to figure it out. But you can't persevere without curiosity. You can't persevere without that phrase of, I wonder. And if you're listening to this or watching this podcast episode and you're pre-op, you absolutely are a master at perseverance because you have been fighting to find an answer to your disease of obesity for years, if not decades. You absolutely have persevered. You know how to persevere. You've already done that.
Yes.
That resistance comes when you think about surgery as being this big, huge, scary, life-altering thing that may or may not work. There's a lot of fear behind that.
Yes.
Surgery is a big, scary thing, and you don't really know what is on the other side of it. Your anatomy is going to be changed. We're not saying any of those things. What we are saying, though, is all of those things are true. And what's also true is it's the most effective treatment for the disease of obesity. It has the lowest chance of complications. Long-term, short-term outcomes are phenomenal. Unlike medications, it is with you forever. It is the one thing that you can onboard that cannot be taken away from you in this fight against the disease of obesity. So that fear can exist there, and it can be met with your perseverance and your curiosity to just look around the fear and go, well, what's on the other side of that? You making that appointment with a bariatric surgeon, that's persevering around that fear. And you making an appointment and a consultation and learning more about it is not you committing to doing it. It's you simply persevering and continuing to fight against this thing that you just don't have the right tool for yet.
Yep. And I get it. Surgery is a scary, scary thing. Like, it sounds so big.
Yeah.
But it's also one of the safest things that we do. And when we compare it to obesity, it's a whole heck of a lot safer.
Yep.
It is safer than diabetes. It is safer than the cancer that you develop because of obesity. It is safer than the sleep apnea that you risk every single night. It is actually as safe as taking out your gallbladder or your appendix or replacing your knee. Because we study this very, very deeply, and bariatric surgery is incredibly well regulated. It is the same risk factors, if not slightly safer, than me taking out your gallbladder or your appendix. Because we do go through a lot of processes. It's not a walk in, get surgery next day, walk out. There is a process to this, and we are going to get you checked out. We're going to make you medically optimized. We are going to do this in a controlled setting. And you just need to find somebody that you trust. So one of the biggest outcome predictors of surgery is your trust in your surgeon and your preoperative education. You need to find someone that you are comfortable with. And if you are not comfortable with them, find another one. And if you're not comfortable with them, find another one.
Yeah,
It's
no, we can try on. Everybody thinks that you're kind of stuck with the one that's local to you, and it's simply not true. Right. We can try on our surgeons, we can try on our centers like we try on a pair of Levi's. Yes. We are allowed to shop around, and with so many options now, and with the ability to travel all over the nation, you really can find that person. You can find that center that is that partner for you. So know that you are not limited to what is around you. We all hope that you can find somebody that you can partner with locally, but if not, pick up the phone, call Dr. Hayek, literally call the Kentucky Bariatric Institute, say, I'd like to make a virtual consultation. Awesome. Yes. Cool. Yep. They do that. They do that.
We do that. We operate on people from all across the country, all across the world, actually.
Right. Well, and the reason.
Okay.
Yeah. Yes. Yep. And the reason that people trust you is for all those reasons that you said.
What's not okay is being afraid, is having a relationship that you don't trust and going into it with that barrier and that anxiety and that fear that this isn't going to work, that this isn't the right fit for me. That's not okay. But finding that relationship with somebody that you click with, that you can trust, that you're like, you know what? I actually think this is going to work because I get it. We try to teach a lot about our why, like not just here are the rules, but why? Because it doesn't matter that I have a rule, right? Okay. Don't eat a cheeseburger the night that you go home after bariatric surgery. It sounds like a pretty reasonable rule, right? But how about we talk about why? Why do I say that? Because I'm not just out here making up rules. There are reasons why. And if I can teach you why, then you can make those right choices. And you can understand why I'm making the choices that I'm making. I'm making the recommendations that I'm making. I can understand your why. Why are you here? Why weren't you here 6 months ago? What has changed and what are you looking for that can help me understand why for you? I'm going to teach you my why. And I think sometimes it's hard to know your own why.
It is very hard. In fact, we just had a lengthy conversation about this in BariNation. All of our experts. So in BariNation, we have weekly virtual support groups, classes, and meetups. Our support groups are led by licensed mental health professionals. Our classes are taught by credentialed experts like registered dietitians, surgeons teach. And then we have meetups that are hosted peer to peer. But the most important thing that we really focus on in BariNation is we are going to deliver expert education with the why. So we are going to teach you why, right? Like, how do I shift my mindset? Or we're going to help you acknowledge like, oh, maybe me thinking or believing that isn't actually helping. So here's how you can change it. And here's why it's important to change it, right? We're going to tell you to eat protein first. Here's why it's important that we do that. Because when we know the why, it's really hard for us to do the opposite. Yeah. Because when we feel like, I don't want to move my body, or I don't feel like starting with protein today. Okay. But when you have that why in the back of your head, that why is going to go, but you do know that this is the reason that you're doing this. So even though you don't want to do it, okay, this is why you actually need to do it. And it's really hard for us to overpower that why with our feeling because, okay, I'm feeling that way. That's not a fact. What is a fact is I need to take my vitamins. I need to eat my protein. I need to move. I need to connect with community for these reasons.
Yep. Exactly.
Right? It's a tool. Yeah. It's a tool that we use to get past that. You said something, and I would love to segue here just a little bit. It's still related to the conversation,
Go for it.
and it has to do with helping people kind of move past that fear to get curious. So, in your intro, you said the KBI and you are a robotic surgeon. And
Yes.
I think it's important to point out to people, there are two ways that most bariatric surgeries happen. One is laparoscopically and one is robotically. And some of the research, the data out there shows that robotic can have superior outcomes to laparoscopic. And by superior, it's like shorter recovery times, right? There's different things that go into it.
Right.
But will you explain like what is robotic surgery and why do you prefer it over laparoscopic?
Absolutely. So first of all, both are very safe. So if you connect with a surgeon who does it laparoscopically and they are skilled and great at laparoscopic surgery, fantastic. Please do not feel that in some way that is inferior. It's just that robotic surgery provides some additional things which are really nice. So awesome platform. It has come so far. There's been a ton of research into this, but basically robotic surgery, first of all, we are in the room with you. A lot of people somehow think that I'm like out there drinking my coffee or something. I am not. I am in the room with you. I promise. Okay. So we are in the room. Somebody's at bedside with you, immediately available. And if I ever needed to get back in for an emergency, which knock on every bit of wood that exists in this whole house, but if I ever needed to get back in emergently, I could be back in and at your bedside in 30 seconds. So robotic surgery is something that has this big barrier that people think about, but I don't think you sometimes think about the benefits that it gives to your surgeon. So when we're operating laparoscopically, the instruments that we use are a straight stick. So it's kind of like this long stick, and the very end of it has a little dial that can twist, and then some of the instruments open, some of the instruments grasp, some of the instruments have electricity connected to them so they can cauterize things for us. They do a variety of things at the end of this, but it is a straight stick. So I kind of equate that to taking your surgeon and putting braces on my elbows. And then making me kind of operate like Barbie, right? Like I can turn my wrists, but I'm locked in a straight stick from my shoulder to my wrist. Robotic surgery is a little different. Robotic surgery gives us extra joints. So we get those elbows back, we get those wrists back, and we have some greater mobility and greater movement with the robot. It takes away the small little motion abnormalities that we all have. If you take a straight stick that's 2 feet long and you hold it straight out like this, the end of it's going to move. I don't care how smooth we think we are as surgeons and how, steady hands we think we have, it's going to move. Right. There is always some aspect of a little bit of a shake, a little bit of a move. The robot actually takes that away from us. So that's gone. So it is completely stable. We can move instruments, set them where we want them to be, and they will not move. When I'm laparoscopic, I can only use my 2 hands, and then I have somebody else working the other 2 hands. Now, that somebody else may even be Dr. Smith, who is an absolutely incredible, accomplished surgeon who has done thousands of bariatric procedures. But if the 2 of us are trying to work together and use 2 brains to accomplish one task, even if it's something that we've both done thousands of times, even if we've done it together thousands of times, you're still using 2 brains, and that introduces some communication. It's kind of like running a 3-legged race. There is just more that you need to kind of communicate and manage. Robotically, I get 4 arms all to myself. So I kind of get to, it's just me. I don't have another brain that I need to communicate with and make sure that we are on the same track. I get to be in control of all of those arms.
Wow.
Surgeons have a little bit of a reputation for having a little bit of control issues, so we kind of like that. So, there's
so checks.
Which is great. That's okay. That's why we're so safe at what we do, but it's there. And then there's also just the optics on it. The actual camera on it is really, really good. It increases the magnification. We can see in true 3 dimensions. And I'm very comfortable while I'm operating as weird as that may seem, anytime you're trying to perform a very delicate task, if you're trying to perform a very delicate task, but your body needs to be contorted in an awkward position while you do it, and you're having low back pain or your shoulder is hurting you while you're trying to do it, it's just frustrating, right?
Mm-hmm.
As a robotic surgeon, I am sitting in a very comfortable chair. I am in my maximized ergonomics. I am as comfortable as I can possibly be so that my decision making is never altered by my own physical comfort. It is, how can I achieve this? And even if it means that we have to be in an awkward position, the robot is the one in the awkward position, not me. It's the one taking the physical difficulty of this. It's not standing, on one hip turned, trying to look around this corner. Like, the robot can do that. I don't need to do that. So it's a really nice tool for us as surgeons to make sure that we are as safe, as controlled as possible. Robotic surgery is certainly something that takes some training. And so there are additional trainings for robotic surgery. And that's why we travel around and teach other surgeons and try to help them get set up and those sorts of things. And people come and they learn from us all the time. So we do that. There's additional training. There's additional checks and balances. There's additional resources for us. So just kind of like there's BariNation and that community of, population of similar, we have a similar thing. We have that for the robot. And so we have other robotic surgeons that we are connected in with, and we can troubleshoot and we can talk about things and how to make it as smooth, safe, and effective as we possibly can. Of course, that exists in the laparoscopic community as well. As I said, it is also a very safe procedure in a laparoscopic surgeon's hands. Do not feel that it is inferior. It's just a nice technology kind of additive that we can use to give you as safe recovery as we can. It reduces the amount of force that we put on your belly while you're in the operating room, so you feel a little bit better, a little bit faster. You recover a little bit faster. I can be super precise about the procedure and about the movements that I'm making inside your belly to try to minimize all of that, make your procedure as efficient but safe as we possibly can, really see things in great detail. So it's an awesome tool. Thank God that we have these amazing engineers out there that think the way that they do, that create these things, that are out there building this for us to advance us and move us along. And it's got some really great potential here in the future too, for kind of assisting us with identifying other things that maybe, we don't see as surgeons, feeling the exact thickness of a staple before it's fired. The robot fires the staple to be the exact thickness that it needs to be, not what my eyeballs are guessing it to be. So there's some really cool technology like that it has.
Oh, wow. I didn't realize. I mean, I've seen the robot. I've seen the new robot, the DV5.
The DV5, yeah.
Yep. I'm not an operating room, but I've seen it on display, and, and we interact all the time with Da Vinci surgeons, and the equipment is incredible to see. And I've seen videos of it, and I've talked with the surgeons about why they love it so much. And it's just so interesting to hear the differences from your perspective as somebody that has done both. My procedure was laparoscopic. It was fabulous. I mean, I had a great recovery, no qualms whatsoever. And it's just so nice to know. I mean, I guess with all things in life, right? You see technology making advancements in all fronts. Yeah. And with laparoscopic surgery, the advancements that they're making are huge. It's with the equipment, right? It's with what they can do. They're still making advancements in that area. Robotic surgery it's the same surgery, just with a different tool. And that tool is making advancements as well. And it sounds like the advancements that they've made have really made a huge impact on your ability to perform surgeries. It's helped you level up. So this technology is helping you become a better surgeon, which means that you're producing better results for your patients.
Yes. Yep.
Dang.
It really does. It's wonderful. And it gives us all sorts of data back to ourselves. Like, we can see how many instrument exchanges did we do? How long did we take to do this step of the procedure? All that kind of stuff. So we get a lot of data back about ourselves when you use the robot.
Oh.
so that we can learn and practice. It's kind of like, if you play in the NFL, you play and then you go back and you watch the game again and you watch your own footage and you watch your own reels and you see what could I have done better there. We do the same. And the robot gives us all that kind of data where we can say, you know what? For some reason, I wasn't very efficient there, or that didn't go as smoothly as it did last time, whatever it may. How am I going to fix this? How am I going to adjust this? How can I compare this to something else that if I get faced with a challenge, I know how to overcome it and I have the data to actually show that.
That's incredible. I mean,
pretty cool.
Oh, that is because that's how we improve. It's why we as patients, we're tracking data to see what's working, what's not working. We're making tweaks, right? We're getting curious about what that feedback is. And then we're making different decisions based on that. So it's so cool that you have this technology that is allowing you to be your own Monday morning quarterback, for lack of a better term, and then improve your craft as you go.
Exactly. And it's all in an app on my phone. It's like the craziest thing. I can just click it and boom, there it is.
I mean, it's 2025 now, so of course everything's on an app. Oh my gosh. Awesome. Well, thank you for explaining that, right? Because if you are thinking about having bariatric surgery, this is a great question to ask whoever you're kind of interviewing, right? What type of surgery do you perform? Is it laparoscopic or is it robotic? And now hopefully you have a little bit of insight into what those differences are, and that you're leaving this conversation knowing that whatever your surgeon is proficient at, that is an excellent choice for you, right?
Exactly. You want your surgeon to perform the surgery the way that they feel most comfortable doing it.
Yes,
that's the answer.
Yes, you do. I would not feel comfortable going to a surgeon. Yeah, no, they have to be masters at their craft, and then the tools that they use are the tools that they use. I would never expect my husband to just all of a sudden start using, I don't know, different style wrenches, or just automatically switch to new work boots, or no. Like he knows what he's doing using that set of tools, and I would bet on that every single day of the week. So awesome. Well, thank you for helping me understand that a little bit better.
It's super cool stuff.
It is super cool stuff. Awesome. Well, I've got one more pivot. If you're okay, so I've been excited to ask you these questions too. So it's 2025 now, and I'm just scrolling down through here are my notes. The new year is ahead of us. So when you look on the obesity treatment horizon for this year, what do you see? What is coming down the road for treatments? Yeah.
So really interesting. And a lot of this is being driven by our insurance companies, insurance approvals, is we have all of these medications now out there. We have various ways that we're getting the medications. So we've been getting the medications through insurance. We've been getting the medications compounded through other pharmacies. All those sorts of things are playing in. And we're realizing that, one, as a nation, Americans are not very good at taking medications long term. It's just, we're just not. And if you look at it, it's just hard. I get it. I forget to take my multivitamin some days. It's a hard thing to do. And especially injection medications can be really hard for people to stay on. So as much as it is a great adjunct and those sorts of things, the insurance barriers are still there. Compounding pharmacies are something that you just need to do your research on. Right? There are some that are great, and then there are others that you just need to understand the lack of regulations, the lack of oversight, and make sure that you're just being safe with what you put into your body. And there are many that do it really, really well. So they're out there. But I think we're realizing where these medications fit into the disease process of obesity. And it's not the cure. It's part of the treatment plan, but it's not the cure. So it's an adjunct. It's a way to help. It's a way to supplement before, after, those sorts of things. But I think we're kind of starting to realize where they fit into the disease process of obesity a little bit more, and realizing that it is a supplement to what we do. It's not the answer. It's part of the answer.
So it's the secondary treatment, not the primary treatment. It's
For most people, yes.
Okay, yeah,
For most people, it's a secondary treatment.
okay. Gotcha.
So I kind of see that coming at us. I do see bariatric surgery itself getting a little bit more mainstream. Something that is starting to feel like a movement of our nation recognizing this epidemic,
Mm-hmm.
realizing that in the last 5 years, we have been through a lot. We have changed our world a lot.
Mm-hmm.
For better, for worse, for, a lot of things changed when COVID hit.
Mm-hmm.
And we became a lot more isolated as individuals. And so I think we're starting to come out of that. We're starting to pull our heads out of it, realizing that we want those interactions back. We want to be, we are social creatures. We want to be social with other people. And so finding your way to do that comfortably and to feel confident in those interactions and to enjoy social things. And bariatric surgery is actually a very social thing.
It is now.
This is it, right? Like, so building that and really embracing that and getting people to realize that there is this huge community out here. We do have lots and lots of people who have had bariatric surgery, who are curious about bariatric surgery, who qualify, and connecting them. Like, we are seeing more of that, especially social media. It has really helped kind of connect people. And more people are coming to us saying, I'm curious about it because I've seen this, I joined this group, whatever it is, but they're coming because of the social interactions that they're having with others.
Mm-hmm.
And I love that. I love that we're getting back out into the world and we're interacting more and we're doing all of that. But it also is, people are finding their communities, and they're finding communities that say, hey, this is safe, it's effective, and it can really be a huge life-changing tool.
It in the words of Lizzo, it is about damn time. I mean,
it is.
It just makes me so happy. I mean, I kick myself sometimes because I waited 10 years to have surgery. When soon after I got married, my husband Grady was like, "Have you ever thought about weight loss surgery?" And I was like, "Oh hell no!" Then I went on. That was for my 600-pound life, and I had surgery when the time was right for me. Full stop. But I am so excited. I'm so hopeful for people, especially like now, if you're listening, if you're watching, 2025 is your year. This is the year.
Yes.
Stop banging your head against the wall. Stop trying to build your house without the right tools. This is your year to get curious and do something differently. Do something differently. Right. And it makes me so happy to know that more people are open to that they are being curious and they're moving forward and they're saying, I know enough people. I follow people. I'm a part of a community. I know I have an idea for what life is going to be like on the other side of it. And I'm ready to learn more. Yes.
What if you left your shame at the door and took the next step? Found someone that you believe in, that you trust in, and took the next step. Because it's not a shameful disease. No disease should be shameful.
Yeah.
It's a disease.
Yeah.
The fact that you've been told in the past that it's on you and you need to treat it and you need to do all of this is miseducation. Mm-hmm. It just is. Mm-hmm. You are wonderful and perfectly fine and a wonderful, perfect human being. You would not be here if it weren't for you having a wonderful, amazing body that has gotten you this far. Mm-hmm. But what if we took better care of that body? What if we treated our body better? Mm-hmm. Where would we be in 2026?
It is such an empowering question, right? What if? What if I tried something differently? What if I thought about this differently? What if I connected with a community? What if because the question that scares me the most and that I will ask myself when I'm making a big decision is, well, what if I don't? What if you don't do something differently this year? What is going to happen? The answer is probably more of the same. And you're going to be at the end of this year saying, oh my gosh, right? Like the great thing about curiosity, the great thing about doing something differently is you're not necessarily committing to that path forever. But what you are doing is saying, in the next moment, I'm going to try this. I'm going to learn a little bit about that. And if you do make the decision of bariatric surgery, that is a moment where your life is never going back. But it is a moment and it is a decision that can give you your life back, that can set your life on a different path, on a different trajectory. It helps you regain your life that you have been feeling disconnected from for so many years.
Yep.
It's such a powerful tool. It's such a powerful tool. And I hope you guys are leaving this conversation, no matter where you are in your bariatric journey, understanding the role that curiosity can play in your life, right? If things are going well, get curious. What would happen if I just stayed the course? If you know that something has to change, like, just do it.
I can't wait to plug back in with you guys 6 months, a year from now, and tell you what happened when my husband said, what if? Where are we at now?
Oh my gosh.
Right? I can't wait. I'm so excited. Like, it has energized me so much to figure out what if.
Yeah. Right?
Yeah. What if we did do this? I can't wait. It's been crazy. Like, it's been crazy to go through it. I'm learning so much, and that's been my, like, what if I just embrace this and go along and stop trying to be the doctor and start trying to be the support person?
Oh, look at you leaning into your own curiosity.
It's hard. It's a weird, uncomfortable position. I'm not going to lie. It's real hard.
Well, welcome
I'll tell
to
you how it goes.
Yeah, I was going to say, welcome to every bariatric person's life. It's real weird. It's real uncomfortable. And you don't know what the heck is next, but you just go slow. And lucky for you, Dr. Hayek, you are a part of BariNation as well. You have an entire community that you get to lean into as well.
Yes. I'm embracing it. I'm here for the weird.
Oh, I love it. I'm thinking we might need to schedule like a quarterly check-in with you just to see how things are going, because this conversation, I mean, now you're on the journey with your husband for the rest of his life, for your life together. And we are just so excited to continue to check in with you and to check in with him and to see the power of curiosity play out in real time.
Yeah, exactly.
Oh. Dr. Hayek, where can people connect with you if they would like to continue the conversation or if they would like to book that virtual consultation?
Absolutely. So Kentucky Bariatric Institute, you can find us, Google us, find us. It's myself. It's Dr. Eric Smith. We see patients just outside of Lexington, Kentucky, but we also see patients all over the country. And so we have virtual options, and we are more than happy to connect with you. Even if you are post bariatric surgery and still in this journey and still in this process, you need reconnection, you want to ask questions about what's next, anything like that, give us a call. We're there. I'm also on social media. It's surgeon_Sarah_MD. Follow me. I do a lot of like just education, talking about tips and tricks to stay healthy and to stay positive and to really embrace this and hopefully give you my whys and make you think a little bit about your whys.
As you guys can see, Dr. Hayek is an amazing human. She is really here to be a partner for all of us along this bariatric journey. So no matter where you are in the process, if you're contemplating, if you're thinking about it, if you're 3 months post-op, 2 years, 5 years, 10 years, Dr. Hayek can be a resource for you. And we will make sure that all of those places that you can find her are linked in our show notes. And if you are a patient of Dr. Smith or Dr. Hayek and you have not started, you've not accessed that amazing 3-month free membership to BariNation, reach out. Oh my, do it. Oh my gosh. Reach out to Dr. Do it. Do it now. Do it now.
Do it now.
It is available to you. So you can reach out to the center directly. You can also send us a direct message or an email at hello@barination.com. And we are happy to pass along that information for you so you can get rocking and rolling in the BariNation support community. All right, my friend, I think we did it.
All righty.
Oh,
love it.
Well, thank you so much for joining us today. Thank you for sharing your story. Thank you for sharing your husband's story. And really, thank you for helping us kick off this new year with that dose of hope and inspiration and curiosity.
I'm so excited for it. I can't wait to give the updates.
Us too. Thank you, Fred. That wraps up another empowering episode of the BariNation podcast. If you enjoyed today's episode, keep the conversation going by joining the BariNation membership community, where you can attend live support events, access on-demand resources, and find a caring community.
Join us at barination.mn.co. If you found this podcast valuable, help us produce it by becoming a $5 monthly supporter at barinationpodcast.com.
And just remember, at the end of the day, you've got this, we've got you, and we'll see you next time. Bye, everybody.